it's not always a bed of roses in our journey as healthcare workers. And I think another important lesson my patients have taught me is making peace with the end. I think it's an eventuality we will all face, that we will leave this planet Earth at some point. And I've learned children, I don't know what it is, they make peace with that eventuality actually quite well. I remember a case of a child who had leukemia, and we had gone through several cycles of treatment, but somehow we were not gaining control. And I remember her last admission, we were trying to fix an IV access to one of the veins to give medicines, and she just didn't want. She was tired. And I remember she spoke to us, me and my colleagues who were in the room, and she said, it's time to go, and I'm okay to go. And actually that evening, she passed on. But she was peaceful. She was peaceful with that. Another case, actually, and this is what inspired me to do pediatric rheumatology, was a child who had lupus, and she had an infection. She was admitted for the infection, and I remember I came for the night shift, and the nurse who was taking care of her wasn't comfortable because her vital signs, temperature level, oxygen, heart rate was not okay, and the nurse was concerned that maybe this child needs to move to the critical care unit. And when I examined this child, I agreed with the nurse, like, you're right, the condition of this child has changed and we need to transfer to a critical care unit. And she was a big girl, 12. So of course I explained to the parents and told them that we should move to a critical care unit where we can offer better care and be more vigilant, because her condition has changed. And I also turned to the girl, because she was 12. I mean, she knew what was going on, and explained to her that we want to take better care of you. So we are moving you to another section of the hospital. And this young girl looked me in the eye and told me, "Doctor, I am dying and it's my time to go." Me, young, naive, like the toddlers, I can conquer the world. I said, no. We are going to do our best to... Did I even finish speaking? She collapsed. Together with my seniors, we tried to resuscitate. She didn't come back. We were so defeated, distraught, distressed. But it was interesting how she was at peace with that reality. And yet, we who handle, health matters so often, we were not at peace with that. So to reach that level of awareness, to know, and this is the end, and sometimes the end, I'm not just talking about when we will leave this earth, but sometimes it's in a business, and you're like, you know what? I think this is the end of the road of this business. Or it could be a partnership, and it's not working. To recognize that this is the season of the end, and to make peace with that, I think is an important lesson. It allows you to release and to move on. And because of that girl, I'm a pediatric rheumatologist. So make peace with the end.